Hospitals are always overloaded. This is a brief general description of central hospitals such as Bach Mai Hospital, Viet Duc University Hospital, National Hospital of Obstetrics and Gynecology, Vietnam National Children's Hospital or Hanoi Medical University Hospital, etc. Regardless of illness and economic conditions, many people are still willing to bypass to a higher level so they can be treated at central hospitals. It's estimated that unnecessary travel expenses can cost people and society up to tens of thousands of billion dong each year. How to reduce the workload of central hospitals? How can Vietnamese people, wherever they are, get medical services with the best quality? How to get more and more good doctors in Vietnam? Remote medical examination and treatment is expected to be a breakthrough solution. Hanoi Medical University Hospital fulfills the task of medical examination and treatment for people, carries out research, teaches and transfers technology. With more than 4,000 patients who register for a medical examination every day, medical staff's responsibility is a big problem. During the peak period when the hospital opens at 5 a.m, there have been 100 to 200 patients waiting for us. We have realized that telemedicine or telehealth is a trend for a long time, which helps doctors effectively treat patients, especially patient care. We should seriously study and apply this field to all of our health systems. Since 2017, the Ministry of Health has established standards for the remote medical examination and treatment system, including 6 fields. Remote medical consultation, consultation for remote medical examination and treatment, diagnostic imaging consultation, remote pathology consultation, remote surgery consultation, training and transferring technologies for remote medical examination and treatment. In fact, some hospitals have provided support and consultation for remote medical examination and treatment. Remote screening for critical congenital heart disease has been implemented by Hanoi Medical University Hospital, and the Administration of Medical Examination and Treatment has consulted COVID-19 patients recently. However, it is just a separate and discrete activity. Hospitals have not particularly concerned themselves about investing in equipment and technologies for remote medical examination and treatment. Therefore, from 2017 up to present, the number of hospitals and activities involved in remote medical examination and treatment is still low. Following the call of the Minister of Information and Communications, technology enterprises are together accelerating the transformation of the healthcare industry. Viettel has implemented the remote medical examination and treatment system on the basis of integrating the most modern technologies in the world into a common platform, which suits the actual situations and conditions of the healthcare industry. By integrating technologies on the same system and cloud infrastructure, we can simultaneously implement in tens of thousands of healthcare facilities that have demand without having to develop from the beginning. This system will help patients have more trust in local hospitals when there is support from central hospitals, improved ability, minimising the waste of facilities at local hospitals when they can practice and consult with central hospitals. More importantly, this system will help significantly reduce the number of people going to the hospital. The remote medical examination and treatment system of Viettel is currently satisfying all 6 fields required by the Ministry of Health, including 3 groups of application. Remote Tracking Group helps doctors in detecting and offering immediate solutions upon the patient's first symptoms. The Real-Time Interactive Group helps patients discuss and interact directly with doctors and receive medical instructions anytime, anywhere. Image Archiving and Diagnosis Group helps reduce time and expenses for patients for on-site consultation with specialists. With the widespread 4G facility and an increasing number of residents using smartphones in the community, the remote medical examination and treatment system will quickly reach remote areas, helping the people, wherever they are, connect with the modern medical system. This is also the first fairly complete system owned by Vietnam, that effectively supports hospitals in developing, training and expanding their scale, especially information security and data safety. In the future, Viettel will expand to offer this solution integrated with the personal health document system and the insurance payment finalisation system of the Vietnam social insurance and non-cash payment. It was not a coincidence that the remote medical examination and treatment system were predicted to be in the top 10 of the technological applications likely to change healthcare activities in the future. This is the trend of development of the healthcare industry in major countries such as the US, Japan, the UK, France and so on. In China alone, remote medical examination has nearly 400 million registered accounts with 70 million monthly users. In the next phase, when Viettel invests in generalizing 5G technology in Vietnam with the possibility of interconnection and real-time processing, the remote medical examination and treatment system will still develop the possibility of remote surgery. The best doctors anywhere in the world can directly take part in the treatment of patients in Vietnam. And at the moment, during the pandemic of COVID-19, the remote medical examination and treatment system will truly bring into play the efficiency of examination and treatment for the people, while ensuring the requirement of social distancing, especially for elderly patients who meet difficulties in transportation, patients in remote areas nationwide, and implemented correctly as per the Prime Minister's Directive 16. It can be said that Viettel has offered numerous solutions for healthcare in the past, such as electronic medical record system, national immunisation system, pharmacy management system, national medicine database management system, food safety system, and the remote medical examination and treatment system continues to be the significant step in the digital transformation process of Vietnam's healthcare industry, all for the health of Vietnamese citizens. Because health is the foremost asset. He who has health has hope, and he who has hope has everything.